Hello, friends. My name is Dr. Tamelus Ezugo. I am here to give you an overview of HDPTC projects implementation. HDPTC stands for Heart Disease Prevention and Training Center. It has its African headquarters at Nsukka in Enugu State, Nigeria. This is the center. It is fully functioning. It houses library that has over 13,000 books, computers learning center. Of course, it houses also clinic that takes care of patients ranging from cardiovascular disease and other illnesses, and also radiological centers for things like ultrasound, X-ray, CAT scan, EKG, many testing modalities, and of course the lab and staffing ranging from cardiologists, primary care physicians, radiographers, nurses, community health workers, ancillary staff, and many more. What is the mission of HDPTC? The mission of HDPTC is to provide quality care access in a more excellent way to underserved communities worldwide. The long-term goal is for heart disease prevention by creating medical clinics and giving patients access to those clinics to get care. Of course, as you know, a healthy soul is important for a healthy body and vice versa. So we do give out 1-year Bibles to patients for soul prevention as well. We train local expertise. In that way, we have pipeline to sustain the services we provide in the community. As we say, we establish libraries not only to keep people up to date, but also to learn other skills and also be able to see that the quality care is delivered in the most current way. We work with local schools to allow shadowing and also, give them opportunity to learn skills and also begin to think about, future professions that could help in their community. How do we do this? Well, we use a lot of technology and connectivity. For healthcare, we use electronic health records. In that way, the records are there. We can view and help them and manage patients. We also do remote patient monitoring, which allows patients to put in their vitals, blood pressure, blood sugar, oxygen saturation, and we can see them from distance and be able to really intervene early before any problem happens. And we do telemedicine, which allows people to be able to be connected with a physician or care provider to manage their condition or do consultation. We do partnerships with government agencies, churches, individuals, corporations, and any other entities that want to do partnership with us to provide care in their area. And we use what we call Global Association of Benevolent Practitioners. That's a DBA of HDPTC. I'll tell you more about this. It's called GAP. Again, it stands for Global Association of Benevolent Practitioners. So what is GAP? Well, as I mentioned, this again is Global Association of Benevolent Practitioners. What GAP does is to bridge the gaps in diagnostic acumen, knowledge, or care delivery, and collaboration of access of providers in underserved communities with other practitioners and specialists worldwide. In that way, care can be delivered from a distance to a local area in an expert way. Who can be a GAP member? GAP membership is open to all practitioners who are benevolent inclined in their deed, work, and action. It's not only limited to medical people. You can be a technologist, a computer person, or any other skill that you may have and be a GAP member, help to train communities in you, in what you do, and deliver those services to them. GAP members are givers. They are benevolent individuals. So there's no cost to register. And all you have to do is you go to hdpc.org and then click on GAP, and from there, become, register to be a member. What is HDPPC health system designed for nations? This is the format we really have for many countries. HDPPC has many sites like in Nigeria, and is also trying to open a site now in Ghana. It has been registered there. And generally, the goal is to reach patients wherever they may be. And all patients can be seen through a local area. It could be a doctor's office or a pharmacy or community health care, or even in anything, any place, their church or whatever. So we usually have affiliations with this level and create what we call kiosks, where patients can come in there, have their blood pressure checked or blood sugar checked, and of course recorded. As you know, many patients in underserved areas don't even have a blood pressure machine. So if you provide a place where they can go and have those checked, even if they're under the care of a doctor, when they're checking them and they're giving them those readings to take to their doctor. But also, if their numbers are really running high, whoever is checking them can then refer them to a center where they can be taken care of, or connect them to a doctor or a center for care. We also have state branches. In the state branches, we have healthcare centers and clinics and doctors, and also we have diagnostic sites where they can be referred for testing. Okay, and from there, if additional information is needed, or so consultation with cardiology or something, then they are referred to a cardiologist or a center where a higher end diagnostic thing is needed. So in each country, we will have a headquarters, we have state branches, and then we have affiliates to help us reach those patients. Again, our goal is HDPPC Global, underscore that. We use GAP, as we mentioned. GAP has, we have the program and services strategy where GAP has doctors who are GAP members. We have virtual assistants that help. We have community health workers, and also have lab scientists and others. So there are many, many people who can become members of GAP to provide certain services. So about HDPPC GAP model and strategy. GAP is a benevolent network, not a program. GAP is designed for improvement of global health. GAP is a practitioner's led, which means the person leading a particular GAP program should know more about the program, be an expert on that, and help design it as needed in that community for us to make that function. GAP is also known as HDPTC because it's a DBA of HDPTC, a Maryland-based USA nonprofit organization. GAP provides access to quality care globally. GAP charges for services to ensure viability and sustainability. Of course, those charges are nominal. GAP has arms which provide services, training, and education, and many more. Each GAP arm has multiple programs managed by HDPTC. HDPTC is responsible for program development, processes, and administration. Any practitioner participating in any GAP program is automatically enrolled as a GAP member. Other practitioners not participating in GAP program can become GAP network members. HDPTC sites may choose to or not to participate in any specific GAP program. As you know, GAP programs are designed in specific communities, so whatever may be applicable to one community may not be applicable to the other, and that's why this is there. Each HDPTC site and GAP program will have a management committee that reports to HDPTC_global on program issues and concerns. HDPTC Global is designed to grow and become a global network designed for healthier So I want you to listen to this video, which will tell you more about GAP and what we do.
Welcome to GAP, the Global Association of Benevolent Practitioners of HDPTC, where compassion meets action and every hand makes a difference. Our mission is to provide quality care in a more excellent way. Ours is a ministry. At GAP, we are committed to empowering individuals to serve as inspiration for positive change. Discover our stories. Follow us. Our voluntary services provides opportunity for change through training, education and scholarship. Also, access to healthcare and medical insurance, and opportunity for disease prevention and early detection. We are GAP. We want you to join us, help us fill meaningful gaps in patient care and services. Make a difference. If you are a government agency, if you are an individual, if you are a representative of any company, we can partner with you. Membership is free. Be the change within your community. If you're benevolent inclined and you want to do good, join us to make a difference. Thank you.
So this the information about GAP. So now, what does HDPTC do? HDPTC roles and other partners' role when we have a partnership. Well, HDPTC for a clinic will train community health workers. We are looking for Maryland certification and also certification from other states, so we can train and give people certification to do community health work. They do for Maryland, they do their 100 hours of work on our online platform, and then they do the practicum at HDPTC sites in their host state or country. We focus on training some people who are going to stay in a community in a longer duration, such as nuns or sisters or people who are married within that community or who are very much interested in serving in those communities and can stay there after training. We provide electronic health record access to the place for telemedicine and remote patient monitoring. We also provide online nurses and virtual assistants that are healthcare providers or other areas depending on what the gap need being done is. We provide training, industrial training for people who wants to learn, and also shadowing opportunity, of course, library access, as mentioned earlier, in the communities. We also seek healthcare equipment and other needed equipment from donors and put it in those clinics for the communities or whatever the need is in those communities. We provide access to quality care to each community, like a patient can have an access to the community health worker in their community, and then the community health worker, access to a nurse or virtual assistant who then will have access directly to a GAP doctor, or through their own local doctor before the GAP doctor. The role of our partners includes that a partner should be able to provide a working facility or facilities with security, power, network, etc., to see that we can do the work needed. They also will fund the program for each site as they think fit, and also provide healthcare insurance access to the community, which will allow us to then buy those healthcare, and they'll be able to distribute it to people and from donors who may want to purchase health insurance and many other things that may be needed to make sure that we can function very well in that community. We established kiosks we have different levels. You can have a level 1 kiosk, which is just a center like in a church or school or village, where people can check their blood pressures, blood sugar, or pulse oximeter. And this is usually manned by a volunteer or a community health worker. Now, you have to understand in many of these communities, people cannot afford blood pressure machine or blood sugar machine, so they need to go to a place to check them. So if we have a place like a kiosk, level 1 kiosk, they can go there, check those readings for free, they can be recorded and they can take it to their doctor so that their response to treatment will be adjusted accordingly, or they will also know that they are at risk for those who didn't even know. You can also have a level 2 kiosk, which again can be at a church, a school, or village center, and have devices including blood pressure devices, blood sugar devices, and pulse oximeters, and many other equipment that can be used to just pick up early problems. And computers, it's usually manned by volunteers, community health workers, or nuns. In the computer, they'll be able to enter the patient's blood pressure readings in our platform so that the doctor can see that and help to manage those patients and, or intervene early. They have also direct access to virtual assistants, the nurses, the doctors as well in those level 2 kiosks. Now you can be a clinic, setup where you have diagnostic equipment and also echo, EKGs, radiology, equipment, computers, EMRs, RPM devices, blood pressure, blood sugar device, and then these clinics can do outreaches to many areas, and they are usually manned by community health workers, nurses, virtual assistants, and doctors. They have direct access to doctors and GAP members for consultation and telemedicine. And if things get worse, then they can be sent to a major hospital for diagnosis center or HDPTC site that can do the necessary testing and treatment for those patients. And again, they will have direct access to MDs, the doctors, GAP members, consultation, and telemedicine. So again, there are different levels that can be set up in any community. Now, partnerships. How can partnerships help? Well, what we have found is that in many of the centers in developing areas that where we try to open up, there are things that are, create major challenges. Among them is the power to support technological equipment. So many a time we have to put up solar panels to give us the power source. And depending on how the big size the place may be, solar panels set up for uninterruptible power supply may run up to 150,000 US dollars, depending on how big it is. So it depends again what, so we need help with something like that, and people who know this technology can also help in setting up those areas, because to have technology function, we need power, and not only power, but also sustainable power. Also, we need financial support. Because healthcare insurance in some countries may vary from $50 to more per person per year. So people can buy healthcare insurance for people in communities, and it can be rifled out to people who cannot afford it, so they can have access to go to those clinics. And we also, as we mentioned, we give 1-year Bible, which costs about $15 US dollars per Bible. So people can support, they can buy these Bibles, or we can, so that we can give them to patients, really. And people can also support staff salary, which can range from 50 to 100 US dollars per month, depending on the community or more, and also depend on if it's a consultant or not. But so people can support by providing funding to pay for those staff. And of course, prayers. You can become a member and just be praying for us. Again, you can do financial support. You can become a GAP member and bring issues in the community that can be resolved and help use your own knowledge to help us with that, and many other issues. And we really request for ongoing support, because our program is perpetual. It's not to come in the community and just leave. We are there to stay there and sustain and do the right thing for the people. Remember, GAP membership is free. Please join us. We do thank you in advance for all your benevolent services, and we look forward to partnering with you and doing good for the world. Thanks again. God bless you. Reach out to us. Bye-bye.